Hello, today I have the good fortune of having with me David Mason, who's the CEO of Health Connect Partners. All of you probably recognize Health Connect Partners because of the HCP shows that they put together on pharmacy, supply chain, OR, radiology, surgery, and IT. So David, welcome to Healthcare Business News. How are you today?
Very good, Phil. Thank you very much. And thank you for this opportunity to come on board with you today.
Okay, so David, Health Connect Partners is a premier event planner and has been for how many years?
14 years. We've been in business for 14 years.
I see. So this has certainly caused you to change your business. How has the coronavirus impacted the trade show business?
Well, it has impacted it greatly. Severe impact to the meeting business, as you might expect, when mandates come down where no more than 10 people can get together at one time. Certainly impacts the ability to put together a group of healthcare providers and suppliers in one room in one city. And of course, you know, we don't know how long it's going to last, so we're being forced to, you know, figure out other means to connect people.
Yeah, I spoke to your colleague Jason. He told me that you have a new strategy. Tell me about that new strategy.
Yeah, Phil, thank you. You know, we hung on as long as we could. We actually rescheduled our March meeting twice. We rescheduled it for in mid-March. We rescheduled it for the end of May. And as that approached, we kind of felt like that wasn't going to happen. So we rescheduled it to mid-June. And then shortly after that rescheduling, we figured, you know, this is probably not going to happen live. We've got to come up with some other alternative. So we immediately started working with our CIO, who actually had this great idea to put together this reverse concept virtually. So we've come up with a plan to host the conference in a virtual manner where we're going to connect people over a virtual reverse expo. So really excited about it.
Yeah, that's sort of like what we're doing now.
Yeah, exactly. Yes.
So how many people do you think will be involved in this? From the provider side and from the supplier side?
Very good question. So we haven't held our first one yet. Our first one will start next Tuesday, and that'll be with our surgery group. And we've got roughly about 125 or so hospital executives prepared to participate in the reverse expo and reverse trade show. We also have our really high quality education plan for that group as well. And we've probably got I'd say about 90 or so suppliers lined up to get engaged with those providers.
Okay, so you'll have educational, now your normal show would take place over, I think, 3 days. You'll have a section on educational section and then the reverse expo. Is that correct? And the education will all be on via video.
That's correct. So we're this week, well, actually some of it we've already started recording, but this week we'll start finalizing our speakers and getting their educational content recorded. And so the show will actually take place over a week-long period where a couple of days will be education only, and then Tuesday through Thursday, May 5th through 7th, we'll have the Reverse Expo. It's scheduled all day, but the providers are signing up. Since they're able to work from their offices, we didn't want to have it just on a fixed schedule. We allowed them to pick an hour or two that they were available to meet with suppliers. So from 8 to 5 Central, Tuesday through Thursday, they could pick however many hours they were able to participate. Then we'll take those hours and match them up with suppliers in 5-minute segments so that they can meet with about 10 suppliers in an hour that they are participating in the Reverse Expo.
Now, the educational sessions can take place anytime that's convenient for the hospital executive, or is it at a prescribed time only?
It is a prescribed time, but only for the first broadcast. And then after that, it's available, and it'll stay available for about 2 weeks after the end of the, or at least the scheduled end of the conference, to give them time to make sure they catch their education so they can get their CE.
So what do you think? Is this the future?
I think it's the future for a little while, and so at least for the next short period, it's obviously the future. What we've learned is we sort of had something in our back pocket all along. It just took a crisis for us to be able to sit around and strategize and be creative to come up with this model. I don't know that that it'll go away forever. I think people still want to meet face to face and have those interactions. And when you're at a trade show, it's good to catch up with people we hadn't seen in years and have a drink with them and share a glass of wine and just talk about life, not just business. So I don't think it'll go away forever, but I think in the short term, this is what we're going to have to do till we get a handle on this virus, until we get a vaccine. We're going to, things have changed.
How are things in Tennessee? Are things going back to normal, or are people still cautious?
Well, officially, we'll start to open up our state this week, and it's a slow open, with certain things, with certain restrictions. I think from my family and my inner circle, most people are going to be pretty cautious. They're not just going to run right back out there and start going to dinner every night, crowded restaurants. I think it's going to be a kind of a slow process to get people back engaged, but we are starting that process this week, so we're excited about that.
Do you believe that, on a personal note, will you be traveling for vacation, or will you be staying home for vacation?
No, I think we'll travel, but my wife's a little bit more cautious than I am. We'll probably drive, so we'll drive and then drive back so that we can at least control that part of our journey.
And can I assume that everyone at Health Connect Partners is healthy and working remotely?
Yes, absolutely. And I don't know if I said earlier, but about 25% of our workforce already work from home, mostly in our sales capacities. But in our Lebanon office near Nashville, all of our operational group, accounting and so forth, works there. And planning a big meeting and doing the things that we do, working together, is almost critical, but we've learned how to manage it, and we're working from home. And although the state order will probably be lifted Friday, we'll probably continue to work from home for the next 2 weeks. It was encouraged, if you can work from home, please work from home. So we'll probably do that for at least the next 2 weeks, just to be safe.
Okay, well, I personally have attended a number of Health Connect partner events, as Healthcare Business News is a media partner with you, and I always enjoy them. And it will be very interesting for me to see how this turns out. And I want to thank you for spending time with me today, David, and I look forward to seeing you in person sometime in the near future.
Thank you, Phil, and thank you for your friendship. Thank you for your business partnership, and I look forward to seeing you in person as well and enjoying a nice glass of wine.